Now, the first question is, why medication for ADHD? Like, if somebody gets diagnosed, why does the doctor almost immediately start talking about prescription medication? And this is, of course, a fundamentally important question, because before we get into arguments about how to fine-tune and arguments against all the media, pressure that's going on out there, why do we even think about medication for ADHD? And the answer is, of course, that the research is very solid. The research that medications work for ADHD is extremely sound, very well designed, and a lot of it has been done. There's also been research that has shown that the combination of medication plus behavioral therapies, plus counseling and coaching and strategies, medication plus those treatments works even better than medication on its own, and certainly better than therapy on its own. And many parents in my office would say, I've been using parenting strategies, doing my best, it's not really working. When we decided to use medication, all of a sudden the same strategies I was using that weren't working, all of a sudden they're starting to work now. So medication does work well. There's good research it works well, and there's good research that it works in combination with the other treatments. Now, there are some people who can do well without medication, but not everybody. And there are some people who have side effects to medications or don't get a good response to medications. It's relatively few people, but if you're in that category, then, medicines are not the answer. And whether medicines are a great solution or not, you do need to work on strategies as well. Many people talk about the idea that pills don't teach skills. And we do want people to develop skills to improve their functioning as well. I always think about it like, if you take a medication, it doesn't, if you're a child or teen with ADHD, it doesn't make you do your homework. And if you're an adult with ADHD, it doesn't make you organize your paperwork and pay your taxes on time. But if you do take medication, it makes it easier for you when you apply the skills you have, when you put forth your effort. It makes it easier for you to do your homework if you're a child or teen. It makes it easier for you to organize your paperwork and pay your bills when you're an adult with ADHD. So you need to do it all together. But if you take your medication and the teenager sits in front of the Xbox all night long, their homework doesn't magically get done. They just may be focusing better when they're playing Modern Warfare 3. Though usually they don't need medication to play that game because it's so darn stimulating they can pay attention even without medication. And if you're the parent of a child or a teen in particular, you know exactly what I mean. Now, one of the other questions is, are medications overprescribed? In general, I think the answer is no. However, I think there is potentially a paradox. The paradox that, as I see it, and this is just my opinion, it is not informed by research studies. I don't know of any studies being done on this. My sense is there's a paradox where, in general, ADHD medications are not overprescribed. They're underprescribed. There are many people who need ADHD medication who are not taking it, or they take it for a short time and then stop it, or they refuse it, etc. However, at the same time, my concern is that there are certain areas where physicians may be too quick to prescribe or too quick to diagnose without a thorough assessment. And in those circumstances, medicines may be overprescribed. Everybody sort of talks about the 5-minute consultation where, kid's a bit squirmy and not paying attention well. They go to the doctor and 5 minutes later they have a prescription for ADHD medication. I don't know if that really happens. And if it does happen, I don't think it's a significant percentage of individuals. What I know to be true is, although we don't have a reliable blood test, brain scan, genetic test, or anything else to prove with a medical test that ADHD is in any individual, when people follow the well-researched, when doctors follow the well-researched diagnostic protocols to diagnose ADHD, it's a very reliable diagnosis. And then when people take medication for it, it's very reliable that it's going to work and have relatively few side effects, etc. If people don't do a thorough assessment for ADHD, or they cut some corners, etc., then maybe the medications are overprescribed. The important teaching point here is this. Make sure this, and I know you as an individual listening, I may not know who you are or where you are in this moment as you listen to this presentation, but I know that you're committed to learning about ADHD, or you would not be connected to ADD resources and you wouldn't be listening to this presentation. So you know it's very important to get educated, to become an advocate. And part of that education is making sure that you've had a proper assessment for ADHD. The onus, to some degree, is on you and your family or, whatnot, to make sure that the doctor has done a thorough job. And if you're concerned about it, ask questions or ask for a second opinion. Now, just to put this into context, my concept is a 7-step system. The idea is, number 1, get educated about ADHD. You need to know the facts, the new research, information, etc. Number 2 is you have to make sure you have the right diagnosis. Are the elements of the assessment done properly, as I mentioned a moment ago? For parents of kids and teens, parenting strategies and school strategies, they're critical. We have to help create great structure around kids and teens with ADHD. Step 5 are medication treatments. Step 6 are looking at alternative treatments, and there's more and more research being done. The research may not be quite as good as medication treatments with all the randomized double-blind placebo-controlled trials. There's less of that with alternatives, but the amount of research going into things like omega-3 fish oils, diet changes, etc. is growing, and it's important to pay attention to this and use it if it applies to you. And step 7 is treatment integration. So this is which refers to integrating treatment for ADHD with conditions like anxiety or behavior or depression if it's there. And it also refers to integrating treatment with growth and development over time. So as life goes on and the 8-year-old becomes a 12-year-old, becomes a 16-year-old, you need to adapt and monitor for different symptoms that change over time. So I wanted to just mention briefly the 7-step system to point out to you, this is how I suggest people look at all aspects of ADHD. Medication is not step 1, 2, 3, 4, and 5. It's the 5th step. There are other things to get done, and there are steps after it as well. It's not the be-all and end-all, but it does serve a very important role. For adult ADHD, I see this as really the same sort of approach. Education, make sure you have the right diagnosis. And then step 3 is around relationship strategies. And that refers to certainly, romantic relationships, life partnership type thing, marriage and long-term relationships. It also refers to relationships with yourself, self-esteem, how you treat yourself, etc. Then we have occupational strategies, which to some degree is work and strategies that help you with your work. And to some degree, it's around your functioning, your day-to-day functioning, beyond just a pure definition of work. And that's developing skills and strategies that help you with yourself within the world, with others, and the coping skills that you use on a day-to-day basis. And these are very important to develop. Then we have medications, alternatives, and again, treatment integration. Now, obviously, the changes, from a 40-year-old to a 46-year-old are nowhere near as dramatic as the changes from a 10-year-old to a 16-year-old, but things do change with time, even if it's just externally, like the economy, the workplace, etc. Now let's talk about how to think about ADHD medication. And here it is, and I know you've heard these before. They're like eyeglasses or insulin for a diabetic. When I wear glasses, when somebody says, when a parent asks me in my office, will my child get addicted to ADHD medication? I always take off my glasses, well, not always, but very often. I take off my glasses and I say, let me ask you this. Am I addicted to these glasses? Well, it's kind of an absurd question, right? I say, well, if I don't wear them, I don't go through withdrawals. I don't need more glasses to get the same effect over time. But if I don't wear them, I can't really see very well. I need them to function, and legally I can't drive without them because it says so on my driver's license. So they serve an important purpose, and I use them as they're intended to be used. And that's like ADHD medication. Insulin for a diabetic. I'm sure you know this analogy as well. People don't get addicted to insulin. People don't, want to start trying it just for fun. But when, they use it because it's prescribed by the doctor, it helps them, and it's a necessary thing for them. This is when ADHD medications are prescribed to people with a true diagnosis that's been done thoroughly and it's monitored safely. This is what it's like. It's like eyeglasses or insulin for the diabetic. It helps, it makes a difference, and it improves functioning. And that's how we really have to think about it. When I think about insulin for a diabetic, there are many parents who think about ADHD medication and they may feel guilty about it. They're concerned, they're worried about judgment, and they feel guilty for giving their child medicine, like they're going to be judged. If you think of a parent who chooses to put their child on insulin, they never feel guilty about that. They may wish they didn't have to. They may wish or pray that they could take their child's place and take away that difficulty for their child in some magical way of, that of course would never happen, but they never feel guilty about it. And that's how I encourage people to think about ADHD medicine, that it's helpful, it makes a difference, and, there's no major problem with it when it's used safely and monitored effectively. Now, I mentioned the concept in the introduction of 4 medicines. This is what I'm referring to on this slide here. If we look at the medications used to treat ADHD, you'll see in the first column, let me see if I can work this pen. You can see in the first column we have stimulants and the non-stimulant. And in this, so there's 2 main categories, let's say. And these are the first line medications for ADHD, meaning the ones that have been approved by the FDA in the US, and Health Canada, etc., to treat ADHD. In the stimulant medicines, we've got methylphenidate and we've got amphetamines. Let's just talk about these. So the methylphenidate medicines have medicines like Ritalin, Ritalin LA, Bifenton, Concerta, Metadate CD, Daytrana, Focalin, Focalin XR. So some of these medicines like Bifenton is only in Canada, but Metadate CD is in the US. In Europe, there's Equizim. And Bifenton, Metadate, and Equizim are all essentially very similar products of methylphenidate that lasts approximately 8 to 10 hours. Focalin is an isomer, so it's a minor variation on it, but it's essentially the same medicine. And Daytrana is the patch. That's a methylphenidate patch. And there are other ones, methylin, etc. Then we have the amphetamines, Dexedrine, Adderall, Adderall XR, and Vyvanse. So, 2 main groups of stimulants. Then in the non-stimulant category, we have Strattera, atomoxetine, and then we have Intuniv, or Guanfacine XR. And there is also Capvey, which is clonidine, which is approved for ADHD, and it would be in the same category as number 4 over here, Intuniv. Now, this, if you can understand and grasp the importance of this slide, it will help you tremendously in understanding ADHD medication. Let me explain a little bit about what I mean for this, about this. So let's say somebody takes Concerta, for example. It lasts about 12 hours. It's a once-a-day methylphenidate medicine. It's good medicine. People take it in the morning, or let's say a 16-year-old takes it in the morning. It works very well through the day. They can focus well. It wears off just around supper time, and then they can't fall asleep until 2 a.m. Apart from the fact that they're up too late, it's actually worked very well for them. It's helped them. But not getting to bed till so late is really a problem. Well, if that's the case, then it's probably worth staying with a methylphenidate medicine and going ahead and taking a shorter acting version of that same medication, right? So maybe Metadate CD. It's a little shorter acting. It may wear off a little bit earlier in the day, but then hopefully that teen can get to sleep in time to be ready for tomorrow morning. Or let's say if he's not eating supper at all, so he's not eating lunch or supper, and he rushes out the door in the morning and he's not eating breakfast because he doesn't like eating breakfast, then he's hardly getting any calories. Well, if we gave him a shorter acting version of the medicine, maybe he would be hungry in time for supper, right? However, let's say he took Concerta and he had terrible side effects, headaches, or couldn't get out of the house because of terrible headaches. I mean, this is rare, but let's just say for argument's sakes, that's what happened. Well, would it be worth taking a shorter acting version of it? Well, it's got the same ingredient, so probably they'd get headaches as well. If there's a particular type of side effect, it may be worth just leaving that category, at least for now. Maybe it would be different if it was absorbed differently, like the patch, or maybe it would be different if it's Focalin, like the isomer. However, for the most part, it's safe to say if you have a terrible side effect like headaches, let's move on from that category. Then you may go on to an amphetamine category, or if you started with Adderall, you may go back up to the methylphenidate, right? So hopefully you understand the logic. the idea for stimulant responders, the research would suggest that approximately 1/3 of people are going to do better with methylphenidate, 1/3 of people are going to do better with amphetamine medicines, and 1/3 of people, it doesn't really matter which you give them, it's going to make a difference. And when you look at it that way, that's about 85% of people with ADHD are going to have a response to one of the stimulant medicines. If you look at that 85%, you can split it into thirds. So 1/3 better methylphenidate, 1/3 better amphetamines, and 1/3 it doesn't matter which. So whichever your doctor starts, let's say it's Adderall XR or Vyvanse. If that works well, keep going, fine-tune it, adjust it. If it doesn't work well, then switch to a methylphenidate product and see how that goes. Now, when we look at the non-stimulants, your doctor may suggest a non-stimulant first, like Strattera or Intuniv, or even Capvay. That's Kapvay. I'm sorry it's not on the slide. Your doctor may suggest that first, and those work a bit differently. You have to take them every day, and they take longer to start working. Strattera is 4 to 6 weeks, and Intuniv is a little quicker. They have slightly different side effects, etc. When it comes to Intuniv, it's approved for ADHD on its own, and it's also approved for ADHD in combination with one of the stimulants. So if somebody was taking Concerta and it worked pretty well, but not quite well enough, the doctor may add Intuniv in at a low dose to help with sleep and balance out ADHD throughout the day. So that's a way to think about it. Now, another important thing about this four medicine concept is the idea that if a new medicine becomes available, think about this chart and this framework for understanding medicines, and then the first question you should have when a new medicine comes out is, which category does it fit into? So if they developed like a new patch, called Xtrana or something, maybe it's Adderall XR in a Daytrana type patch. I mean, I'm just making stuff up here. But as soon as you found out it was an amphetamine, well, now you know where it fits. And if you've tried Vyvanse and Adderall and had terrible side effects that you couldn't tolerate that medication, you would know because it's in the same category, there's no point in trying that new patch, that's Adderall in the patch, because it probably won't agree with you either. Or you could certainly talk to your doctor and ask, but even if you read some media reports or, news articles and it sounded exciting, you would realize it may not be for you because of the category it's in. So think about it this way. It can help you significantly in understanding it. And I'll tell you, there are probably some people on this line that know this, and there are probably many people on the line that don't. I know that doctors in my community and in many communities don't necessarily realize all of this information. So sometimes I get a referral from a doctor who says, patient has ADHD and doesn't respond to medication. I asked the patient in the consultation, which medicines did you try? They say, we tried Ritalin, Bifenton, and Concerta. Well, let's just go to the chart for a second. They've tried Ritalin, they've tried Bifenton, they've tried Concerta. Out of all of the categories of medication, they've tried one category. And if they had side effects with one category, well, I guess if the doctor didn't know as much about ADHD, the doctor thought they were giving different medications. But in fact, they were giving the same medicine, the same molecule in different forms. So in those cases, of course, I review the whole situation, look at the whole aspects of the treatment, and then I say, well, let's try something from this category or this category. And I'll tell you that Intuniv and Capvay are not in Canada now. Intuniv should be coming to Canada approximately late 2012, more or less, and it should be launched in other countries later on, though I don't know any specifics for that. So hopefully that's clear to you. If you have questions about that, by all means, submit them for the Q&A. Now, so here's a question for you if you're having trouble with medication. I think I explained a lot of this on the last slide, but if you're having trouble with medicine or you have a suboptimal response, you're not getting a great response, one of the questions is, have you had an adequate trial of a medicine from each category? Now, what I mean specifically by an adequate trial is, were you on a high enough dose for long enough? So if somebody went on to Concerta and only took 18 milligrams and they had no benefits and no side effects, and they took it for 4 months, they certainly took it for long enough, but they didn't get to a high enough dose. If they got to 54 milligrams or even 72 milligrams and they took it for at least a couple of weeks or longer, that's long enough to know if it really worked. So the point here is, if you go through each of the categories, if you're not getting a good response with medication, go through each of the categories, make sure you get up to a high enough dose. Obviously, if somebody took 18 milligrams of Concerta and didn't sleep for 20 hours, only slept 4 hours a day, then you wouldn't want to go to a higher dose because the side effects are a problem. But if side effects don't impact, then as long as you get to a high enough dose for long enough, then you can see if it works. And it's reasonable to go step by step, trial and error, working with the doctor to try the different medicines to see if you can find the one that works the best. Now, if we're talking about starting treatments, if you haven't started medication for ADHD, there's a couple of things I want to suggest to you. The first question is, how do you decide if you should take medication? If you want to buy a new car, you have a way of thinking about, how do I buy a car? Do I need a minivan, a sedan, or a sports car? Does it have to have a big trunk or not? Should it be fuel efficient or hybrid or not? And you have how much should it cost? You have a whole bunch of things you're going to think about how to buy a car, because you know how to make that decision. But when it comes to choosing medication for a condition like ADHD, nobody's really taught you how to think about that. So I suggest a couple of things. Number one is evaluate risk versus benefit. So the benefits of ADHD medication are that about 80 to 85% of people have at least a good response to it, sometimes a great response. The risks are about 10 to 15% of people get some side effects. Sometimes they're minor, sometimes they're more than minor. In general, the risk-benefit ratio is pretty good to test it out. You also have to think about the flip side, the risks of not treating. Are there risks? Are things going down the hill? And that sort of thing. And you need to watch for that. Then you need to decide based on impairment. So think about the impairment that ADHD is causing. So when you look at current functioning and you look at potential functioning, there's often a gap there. That's why you go and see the doctor. That's why you even go for an assessment. If there's a gap there, you need to think about that level of impairment and how much impairment is there. Is there mild impairment, moderate impairment, or very severe impairment? If there's severe impairment, probably you should start medicine a lot sooner and a lot more quickly than if there's mild impairment. In the same way, if your blood pressure is mildly elevated and you say to your doctor, don't give me medicine, I'll exercise and lose weight, your doctor probably says, okay, but come back and see me in 2 months and we'll check it again. But if your blood pressure's through the roof, you're going to end up in the emergency department that day getting assessed and probably starting a medicine, or it's really dangerous. And the same analogy applies for ADHD. It's also important to know it's not a lifelong decision. Many parents, let's say have a 6 or 8-year-old, they worry that if they take a prescription, their child is going to have to take it for life. And that's so far from the truth. They may need to take it for a while, but first, let's look at the short term. Let's take 1 to 3 months to fine-tune the medicine, adjust the doses, and figure out if it works. In the middle term, if it's working well, stick with it this school year, maybe next school year. And then in the long term, you're going to monitor height and weight and growth and all that stuff. And you're going to see, and every year or two, working with your doctor, you should try some time without medication and see how you're doing. And then maybe you don't need it, or maybe you find out quickly you do need it. So it's not a lifelong decision. You just have to decide to test it and see if it works. If it turns out that you're in the small percentage who have high side effects and limited benefit, then by all means stop it. Don't worry about the long term. You're not even going to get there. If you've been on medication, you need to fine-tune it. You need to monitor over time. So different circumstances may happen. There may be, certainly when kids and teens are growing, as they get older and bigger and they grow, their metabolism may change, etc. You may need to adjust the dose. And so you have to adjust over time and work with the doctor. You also have to deal with what I'll call our blips, bumps in the road. Sometimes there's something that happens that can be an increased stress for the individual or the family or their education or whatnot. A teenager may go through a major relationship breakup. An adult with ADHD could go through divorce. A teenager could get cut from the football team and be very upset, or get involved with, drugs or alcohol or different things like that. Life changes. We need to adapt over time. So there may be some points where you need to lower medication. There may be some points where you need to increase medication. Or there may be some points where you need to look at treatments for something like depression and anxiety, which may come up or may be a coexisting condition. So you need to monitor over time, because ADHD doesn't stay the same. It changes with time. You need to remember the importance of lifestyle and multimodal treatment. I'll tell you something. If I'm working with an adult with ADHD and their medication dose is steady, and all of a sudden they start working later nights, they're getting less sleep, and their stress level is up, it's going to seem like that medication is not working as well as it used to work because of a lifestyle change. Now, should I raise the dose in that circumstance? Well, maybe, but I don't want to necessarily be raising doses because somebody's not sleeping enough and not taking care of themselves. We need to look at the whole picture, and maybe for a short time it's okay to raise medicine, but I also want them to address the issue of not getting enough sleep and being too stressed out. Now, if they really need to, or they're going to lose their job and lose their house, well, yeah, I'm there to support them. And then at some point I'd like to help them find a strategy to balance things out, to bring balance back into their life. And remember the multimodal treatment. They may need counseling. They may need new strategies. They may need behavioral support or other things. And it's important to keep that in context. And you also need to deal with comorbid conditions, things like depression, anxiety, substance use, learning issues, etc. As they change and adapt over time, you need to monitor and adjust your ADHD treatment appropriately as well. A comment about tolerance. Many people worry about getting tolerant to the ADHD medication. So they're on, let's say, Concerta. I'm not picking on Concerta. It's just commonly used, so I've just picked it. I'll say Adderall XR for now. Adderall XR, and it seems to work very well. And, they're on 20 milligrams. After a while, it doesn't really seem to work, so they try 30. And then after 3 months, it's not really working, so they try 40. Many people worry that this is going to happen. In reality, it's a very small percentage that experience that. But when it happens, it may be that you're developing a tolerance. If you stop medication for a while with your doctor's advice and monitoring, it may kind of reset your tolerance, and then you can start it again at a lower dose and build up if you need to. Sometimes, if somebody responds reasonably well to an amphetamine medicine and reasonably well to a methylphenidate medicine, they may be on let's say Adderall XR, they may switch to Concerta and be okay. And in about 12 years of practice, I've had 2 teens that developed so much tolerance that I would give them 6 weeks of Concerta followed by 6 weeks of Adderall XR versus then 6 weeks of Concerta, so that we were trying to beat the tolerance so that when it developed, we'd switch them to a different class, and that would help to beat the tolerance. Now, I know I said I'd be finished at about 35 minutes past the hour, but I'm not quite there. Let's cover some ADHD in the news, and I'll try to keep it relatively to the point in the next 10 minutes so we can do some Q&A.